Thank you for having me. My name's Margie Oakander. I'm a psychiatrist I work up at the Sunridge Primary Mental Health. I'm part of shared mental health care. And usually, for those of you that have heard me speak before, I'm usually talking about mood and anxiety disorders, comorbidities, pharmacotherapy, but tonight is going to be a very different and very short talk on how to build your resiliency through this pandemic. Some of you might be feeling a little bit like this, perhaps. And what I want to do is build on the wisdom and the strategies that you're using already to help you give a greater sense of control and a greater sense of being able to cope. And these strategies will work for yourself, and as I say, you're probably using many of them already, and they'll also help with your patients, because your patients will be coming to you asking for support and asking for tips. I have to say that putting these slides together, I canvassed a number of my colleagues, family practice colleagues, psychology colleagues, psychiatrists, and so I've distilled that and a lot of information that I've been reading over the last few weeks and tried to really pull it together for you in a very quick little presentation. So if we want to start off with sort of basics, it's fighting fear with facts. So it's looking at trusted sources of information. Where can I get my information? And of course, the AHS website is sort of the truth, if you will, as we know it today. I'm also finding the updates with Dr. Dina Henshaw, our Chief Medical Officer, really valuable on CBC. We want to keep a perspective on the risks, and I keep relating back to what Dr. Gill said a couple of weeks ago, that 80% of individuals that get COVID will have mild to moderate symptoms and not require medical intervention. And so when my patients are asking me and worried about that, those are the statistics that I'm giving them to try to keep the risks in perspective. We want information. We don't want to be inundated. And I was out at a family practice clinic today, and one of the family docs said she's just had to turn off her feed, a lot of her social media feeds. And so she is saying, I am getting too much information from too many different sources. I need to shut down the social media. I need to limit what I'm getting. So really turning off the news and limiting that. And taking a media break can be very helpful. And I think you've probably heard that from a number of different areas. When we look at physical distancing, not social distancing, I think that term's been changed in the last few days. We want to stay socially connected. We want to plan phone and Skype meetings with our friends, with our families. And there's lots of neat ideas, actually, that are coming out. I heard about a Tolstoy book club where people are making their way through War and Peace over the next several weeks. There's lots of exercise groups. There's lots of things that are going on that are really kind of fun and interesting that help us keep socially connected. It's so important. Maintaining a routine, well, that's a tip that I discuss with patients even when we're not in the middle of a pandemic. So keeping that sleep and wake schedule, sleep hygiene, maintaining meal times and healthy eating, building in an exercise routine, building in social time. So if we look at exercise, part of the routine for physical and mental health, we know that physical exercise has level 1 evidence for the treatment of depression, for mild to moderate depression. So it's going to be really important as we go through this pandemic to maintain those routines. We know that there's lots of tips on how to exercise at home. One of my favorite YouTube videos is the Yoga Vidya. I do a shout out for that one. It's free. So there's lots of things that we can be doing to keep up the exercise routine. And getting outside. Have you noticed how many people are outside walking? They're walking their dogs and their kids, and that is getting out in nature. David Kessler, who is a grief therapist and expert who worked with Elizabeth Kubler-Ross, of course, the famous grief guru, if you will, talks about collective grief being in the air, and that is around themes that the world has changed. There's a loss of normalcy, the economic toll that we're taking, plans being canceled, fear of physical danger, all of those things is that collective grief. And we can label this as a time of grief. And I guess it's okay to feel the feelings, feel the anger, feel the fear, let it wash over you, and then take the time to process that. That if we see this as a grief response, then we can somehow deal with that more readily with our strategies. So if we look at the stages of grief, I'm going to go through these really quickly because I think it's interesting how it can apply to this pandemic. The idea of denial, and I met somebody on the weekend who was still in total denial. This virus isn't going to affect us. It's not that bad. It's just the flu. Anger, you're making me stay home, or the government isn't helping me as a physician. I'm feeling attacked. The bargaining, okay, if I distance for a couple of weeks, it's going to be okay, right? And then the sadness around I'm going to go bankrupt because my family practice is shut down. I don't know where this is going to end. And then finally acceptance, that this is happening. And Kessler says that when we have acceptance, that's where the power lies. That's where we find some control, and that's where we can start doing things such as saying to ourselves, I can wash my hands, I can keep the distance, I'm going to keep seeing patients virtually, I'm going to learn how to work with that, and when this is over, patients are still going to need me. Kessler talks about finding meaning in this, so finding meaning, sort of a light at the end of the tunnel, and that's very important to be appreciating the things that we have, the social connections that are cropping up. People are talking more about how they're reaching out by phone and hearing people's voices, walking in nature and all of that. So with anticipatory grief, going to the future and imagining the worst, we have CBT strategies around that. And I garnered some of this cognitive behavioral therapy input from colleagues who work in that area and talking about combating negative thinking. So finding balance in what you're thinking by opposing negative thoughts with positive ones and remembering that there are truly wonderful things in the world. Online CBT tools, and I actually gave a couple of these to patients today. Bounce Back and Mood Gym are both excellent CBT online websites that patients can utilize. Developing positive mantras, we'll get through this, the best brains in the world are working on this. There's lots of acts of compassion, and stocking up on compassion because people are stressed, and I think we're suggesting that we just cut people some slack and be patient. From DBT, and I got some of these ideas from Sarah Lazarek, one of our DBT therapists at the clinic, and also a colleague, clinical psychologist, Daphne Wing, who does trauma-informed therapy. Some really excellent ideas. So progressive muscle relaxation is the MindShift app, and that's the little blue square on the right. Paced breathing, which is another tool from DBT. So that's inhaling through your nose and exhaling long exhales through pursed lips. And what that does is it lowers heart rate and activates the parasympathetic nervous system. And there's an app for that, the Paced Breathing app. Grounding, which is another DBT strategy, so naming 5 things in the room, grounding yourself in space. A strategy from EMDR is the butterfly hug, and you'll see a picture of a woman doing that in the bottom. That's a nice little video on this strategy that incorporates EMDR tapping strategy. It was a strategy used with survivors of a hurricane a few years ago, and there's lots of information on that, the butterfly hug. So there's strategies from all sorts of different areas. If we look at mindfulness, and I got some of these ideas from a colleague in St. Albert, Dr. Patricia Simpson, who's a psychiatrist. If we look at mindfulness, that's coming into the present and being aware of sensations and breathing. Dr. Simpson's favorite website is Tara Brooke. I use the Palouse Mindfulness, which is a little more detailed 8-week program, so maybe not as geared for the beginner. And with the Calgary Connection, the Breath Project, Dr. Phil Bluestein, gastroenterologist here in Calgary, and Dr. Alan Donsky, pediatric psychiatrist, developed the Wellness Through Mindfulness program. So there's some excellent programs here in Calgary. Another CBT program that I want to mention Dr. Wachuku just gave me, and I should have mentioned this, I don't have a slide on it, is the Text for Hope through Alberta Services. So you text COVID 19 HOPE, and you text to 393939, and you can subscribe, and you can get 3 months of cognitive behavioral therapy text messages. So I'm going to be checking that one out. That looks like a very cool CBT strategy that we can add to that list. If we look at information from positive psychology, that's simple things like noticing kindness, doing kind things, checking on an elderly neighbor, savoring small moments of experience and kind of wrapping them up and remembering them, looking at photographs, noticing good things that are happening and having those positive affirmations. Again, patients really enjoy hearing about these things when they're anxious, and these are all strategies that you can try. This is another strategy to clear yourself after you're leaving work, after a tough day, is do some clearing exercises to decrease the impact of that day at work. And I find I actually do these automatically. I didn't realize it was a thing, but I do this. You're looking in the rearview mirror as you drive away, doing some breathing exercises before you start the car, having some rituals when you get in the door can all be really helpful to demark the time at work versus the time at home, so that you can be more present for your friends and your family and yourself. I looked up some tips for healthcare workers and emergency responders, and you can see the sign there, thanks for everything you're doing. There's lots of appreciation out there. Recognizing signs of burnout, if you will, or stress in yourself and in your colleagues, maybe creating a buddy system with people at work just to make sure that everybody's doing okay, managing their workload. Again, we've talked about a lot of these strategies like the breathing, mindfulness, sleep routine, and recognizing that the world isn't all on your shoulders, that it's okay to take breaks, it's okay to monitor your workload, and recognize that you want to make your best contribution. Remember the Physician and Family Support Program. They are there for you. They're just a call away or an email. Good. And also, Dr. Nicholas Mitchell on our AHS website has his mental health moments. So I've been checking those out. He's had one on talking to teenagers. He's had all sorts of really excellent points on those little videos that he's doing. So you might want to check those out as well. In terms of Calgary resources, I'm just going to mention two before I close. The Canadian Mental Health Association also has a email and call support for the patients or clients here in Calgary. And the next one is the Eastside Family Center, and that's a center that I go to every week. We're now closed for walk-in counseling, but they are available for e-therapy, text, and I'm consulting on some of the email therapies that they're doing. So that center is very much has been very much activated by this and is adjusting to the changing times at Eastside Family Center. So there's lots of ideas. Remember, there's hope in this and light at the end of the tunnel. I think those strategies can help you and your patients